Okay, so hello, ladies and gentlemen. Welcome back to this interview series. I am delighted this afternoon to be joined by Tash The Medic. Now, Tash has just finished her third year of medicine at King's College in London. She's an aspiring GP and mental health advocate, and I think it's fair to say is a very active social media medic. Tash, thank you so much for joining me.
No, thanks for asking me to come on and talk about mental health. It's good. It's what I talk about a lot on my social media, so it's nice being able to talk about it on someone else's sort of platform as well.
Definitely. I think it's obviously, as we can all appreciate, a super important topic that not just for medics, but everyone, all uni students, all walks of life would benefit probably to talk about a little bit more than we're good at doing at the moment. So, Tash, obviously I've done a very quick rundown for you. Do you just want to expand a little bit on what I've already said? How did you get where you are?
Sure, yeah. So, I mean, I suppose why I'm advocating for sort of talking about mental health is because of my own illnesses that I've suffered with.
Sure.
So, sort of brief rundown. I suffered with anorexia when I was at school, and then more recently in my university years, suffered with depression and anxiety. So, I think, as a medic, actually going through that myself, I just kind of the whole time I knew that there were other people suffering, but I didn't have like an actual face, like a role model kind of person that had gone through it and got to the other end of it. So I'm kind of trying to do that for other people, and to sort of get rid of all these sort of stigma and myths surrounding like mental health in the medical profession, because they're just absolutely wrong. Like I get so many messages being like, can I still do medicine if I've got depression or whatever, which really frustrates me. So I guess that was like my main motivation in setting up my Instagram. And that's about me. Yeah, everything you said.
No,
I'm
that's all
thinking of
right.
GP, because obviously it includes so much to do with mental health.
Mm.
Yeah.
Okay, well, I mean, there's about a million questions that I think that opening spiel has just generated. So one thing that I'm conscious, or I think would be a good idea, respectfully, is that a lot of the people, certainly when this goes live on my channel, will be younger, maybe thinking about university, or you're going through their A levels and so on. And I think it might be worth, for their benefit, just illustrating. You talked about things like anorexia, depression, anxiety. Maybe just what are all these things,
Yeah.
and maybe particularly in the case of depression and anxiety, how are they different from one another? Because they're often presented together.
Yeah. Sure.
Yeah.
Yeah, so initially when I suffered from anorexia, it sort of stemmed from a form of control. So it was a time when I was applying to medicine, everything was very stressful. And unfortunately, food kind of presented as a way for me to control something in my life. Obviously, this was subconsciously, but sort of looking back on it now, that's kind of where I think it came from. But basically, I was sort of controlling how much I was eating, how much exercise I was doing, and that kind of took over my life, which was extremely draining and absolutely miserable. And then anxiety and depression. So what I had when I was suffering from depression was sort of being so upset and crying without a specific reason. And there was no sort of main reason why in my life I should be sort of miserable. Everything, technically was going really well, which then led to me sort of feeling awfully guilty about how I felt. And then the anxiety sort of presented, where I just get so worried about situations and I can't think rationally, and like the worries just spiral out of control, which someone with a healthy mind, wouldn't go that far. Like obviously we all have worries from time to time, and we all have feelings of anxiety. We all feel anxious from time to time, but I think anxiety is the sort of extent that it gets to where it's stopping you from doing things in life, for example. Which basically mean that you sort of hibernate and shy away from social situations, from lots of different parts of life.
Just to touch on what you said there, Tash, and this is really quite damningly, I think, going to illustrate the point. I have just gone into my final year of med school. Provisionally could be a doctor in the next year or so. And my understanding of anorexia, just to name one of the conditions that you talked about, I mean, I'm guilty as much as of anyone else is thinking, oh, well, that's just people not eating, for example, or kind of being not frightened of eating, but having this kind of fear-based relationship with food. Because I feel like even in medical school, we're not necessarily taught that much about these things, maybe depending on where you go. But is there more? It sounds like from your experience that there's a little more granularity to it than that.
Definitely. I think for me, I never skipped a meal, which is quite unusual, I think, for anorexia. But so no one really picked up on it. But because, you know, I was eating breakfast, lunch, and dinner, but I was eating mainly like vegetables and like salad, which obviously doesn't have enough calories in it. But that was kind of my way. I think that was what was quite clever about it in a way, because no one then picked up on it. People just thought, oh, she's being really healthy. And the thing is, I've always been such a massive foodie and still am now. Like, I love food so much. So I think that's why people never really associated that and me. I think the dangerous thing about, you know, I lost a lot of weight, obviously, and because I was living at home and sort of my parents were seeing this sort of gradual change. Whereas if you sort of met me in this month and then sort of 4 months later, it would have been a massive noticeable difference. Right. But yeah, I think the worst part for me is sort of, I really labeled foods as like good and bad. And there, you know, everything is sort of, it's like the whole moderation thing. Like, chocolate is probably one of those foods that's like labeled unhealthy, but actually it's healthy a little bit here and there, and it's healthy for the soul and mind.
Yeah, sure.
So yeah, it was things like that, and I felt extremely guilty if I sort of ate something that I deemed as unhealthy. So it was kind of, I think, because I sort of suffer from perfectionism traits, so I think it kind of like linked to that as well. I was trying to sort of have this like perfect diet. But yeah, it's kind of one of those things where obviously initially I say it was like about control, but then it sort of spiraled where it was just so out of control at the end. But yeah, it's a difficult one, because I remember when I was a lot younger, before this, a family friend had anorexia, and I remember just thinking, oh, I'll take her to TGI Fridays. Like, that was like my favorite restaurant at the time. That was like, give her a plate of chips. But like, yeah, it's the same with like depression, anxiety. I never sort of dislike people that don't understand it, because I think it is so hard to not completely understand things that you haven't experienced, just the same as I don't completely understand bipolar or other mental health illnesses. But that's why I like talking about it, and then hopefully people will, you know, pick up on some of the other parts of these diseases.
Yeah, for sure. And to be clear, you use the word disease there, which you said two things. You labeled it as a disease, and you said suffering from perfectionism traits, which is not normally something that gets said. And well, well,
perfectionism it's not classified as a disease as of yet, which I believe may change. It's interesting because society sees like sort of being perfect or like perfectionism as like a good aspirational trait to have, but actually it can be seriously damaging. And yeah, like anorexia, depression, anxiety, they are all diseases, they are all illnesses. Like, they're not personality. Yeah, it's interesting because it's not a personality trait.
That's what I was getting at, right?
Yeah.
Because
it's a difficult one.
Sorry, please go ahead.
No, I was just going to say it's a difficult one. I think it kind of stems from what sort of science deems as a disease and what it doesn't. Because there's this thing called orthorexia, which is like not classified as an eating disorder as of yet, but it's basically when you're obsessed with eating healthily. And so I think that kind of fits what I had better, but because it wasn't classified as a disease, I was diagnosed with anorexia. So yeah, it's a weird one.
Yeah, all I was trying to get at there, but you spoke about it very eloquently, was this not just with how science labels processes, but how society does as well. People don't, certainly even when I've had my psych rotations and I've been talking to lots of patients with depression, anxiety, bipolar disorder, people don't, in their own vernacular, tend to talk about them as diseases as such, even though they're a pathology. There may be a disease of the mind, if you like. I still feel like we don't, in day-to-day English, we don't talk about them in the same way that we might talk about pneumonia or atherosclerosis or something.
Yeah, it's really interesting because, you know, all through these sort of mainly depression and the eating disorder, well, mainly depression recently, it wasn't myself. And so I felt completely detached from like my personality, and like that was kind of the disease like having its effect, which is why I'm able to kind of differentiate it as a disease. But I think you're so right with what you said about sort of society not seeing it maybe as like an actual illness, but sort of like someone's personality and that's someone's like character, which it's just not.
The problem, I guess, where we're moving ever towards that state where the mind and body, in terms of medicine and everything else, are seen as linked almost, but there's almost the potential to conflate these things, isn't there? I think just because we've had some really good questions in from people that sent stuff in, and they kind of fit well into what we've been talking about and what you talk about on your own platform. Mental illness as a medical student, because as you said, this is something I hear a lot about as well. People think, you know, I have anxiety, or I have a phobia, or I have depression, or so on and so forth. The feeling that I get from people is that they're not even particularly worried that they wouldn't either perform well or last as a doctor. It's that the system physically would not let them be a doctor. What's your take on all this?
Yeah, I completely agree with you. I think people are so concerned that like the GMC, the General Medical Council, is kind of like this massive powerhouse and will like kick you out of medicine if you've got any sort of kind of illness, which is just not true. And I actually did a post on what fitness to practice actually means, because a lot of people are worried about that term, which basically the GMC has to sort of say that you're safe to be around patients. Like that's the number one priority. It's not always actually looking after the staff, it's more about looking after the patients. And so why would having depression make you unsafe for patients? Like that's what you've got to think. And I think it comes from sort of word of mouth, and sort of because doctors and medical students, you don't hear them speaking about their illnesses. You don't hear that a lot. You know, we kind of view doctors, I mean, maybe not as the godlike figure anymore, but we still view them as like, oh, they know all about these diseases, so they should be able to prevent them themselves. So I think that's where it stems from. So hopefully as more and more doctors and medical students start talking about it, that kind of fear will disappear, because I do understand why people are fearful. Like I was, you know, probably 3 years ago, but I think by having more people talk about it, then that's the way to combat it.
I mean, this does raises a question, and this is one of the questions I got sent in, and I'm trying to think of a way to express it sensitively, so forgive me if I don't, but I'm paraphrasing. Let's say that a medical student has a condition, something like schizophrenia or bipolar disorder, or essentially a condition where there is some risk, modifiable or not, that they may experience some sort of psychotic episode, right? Or that there may come a state where they are unsafe potentially to be around patients. Presumably, the system has some way of coping with that. I mean, this is just, I don't know the answer to this either. If someone, say, has a disorder, but they are suitably medicated, for example, is that acceptable?
Yeah, I think that's the thing with the GMC, which they try and highlight a lot. They just want people to be like honest with them and declare sounds a horrible word. It sounds horribly like serious, but to declare these illnesses, and they want people to, you know, be actively managing them, whether that's, you know, visiting their GP and taking medication, and even if, you know, someone was experiencing like a psychotic episode which wasn't controlled by medication at the time. I mean, I don't officially know this, but what I imagine is that you know, you may be asked to like not practice for a certain amount of time, but it's never going to be like a you're out forever kind of thing. I just can't imagine that ever happening. There's quite a few articles being written by doctors with bipolar. Haven't seen any with people with schizophrenia actually, but yeah, it's a really tricky one, and I think, yeah, I don't really know what more to say on that.
No, I mean, you said yourself before that, and I think this is the ultimate thing that people could take away, is that as far as the GMC is concerned, the patient, it's always about the patient, right? Whatever anyone does, a patient's or your wish or your right to practice medicine does not come before the patient's right to remain safe, ever. However, it's obviously not in the GMC's best interests to just start getting, you know, hemorrhaging doctors, which we're kind of already doing even before you get into that sort of thing. And they do ask you to declare these things, but it is obviously with the intention of keeping the patient safe at the end of the day. So one of the other themes we've had a lot of questions on is if you find yourself either going to medical school with such a condition, or you are maybe diagnosed with such a condition once you get to medical school, which is something I'd also like to talk to you about. How, in your own experience, or how do you think people can manage themselves during studying a medical degree?
Well, I think first of all, it's really important to go and speak to your GP. Like, I think it's interesting because I think people tend to sort of delay seeking medical help, like so far down on the line with a mental health illness, whereas something, you know, a physical health illness, like even a sore throat, you wouldn't even think about it. You would just go. You know, going to see a GP isn't a serious thing. Like, it doesn't mean you're going to be sent home with a packet of antidepressants straight away. Like, I promise you that won't happen. But I think the thing is, from personal experience, what I found is that GPs, your local GP, will have like a list of like all the local services, charities that are available that they can refer you to, or they can tell you about, and then you can self-refer yourself. You know, you can't speak English clearly, but yeah, you can refer yourself even, so it doesn't even have to be like a formal thing, like the doctor needs to refer you. So I got told about like 2 services. So I went to a charity called the Listening Place, which basically sort of, yeah, it's run by complete volunteers who just listen to people who have experienced suicidal thoughts. And then they also told me about Silver Cloud, which is CBT that you can do online, which was perfect because I had so many days where I just couldn't get out of bed. But at least this way, like, I didn't have to travel and see like a therapist. I could just do it from my bed. So I wouldn't have found those 2 services had I had not gone to the GP. So that's the first thing. The second thing is to be really open with your medical school. So there will be someone that like looks after well-being, and like, okay, medical schools might not be the best at providing support, but at the same time they can point you in a few directions, you know, such as I got offered to go and speak to like a disability person to whether I wanted to get disabled student allowances, because they can provide like all sorts of things, like counselling or like physical things. And the most important thing I think, you know, that you can do for yourself is to prioritize, not just prioritize academia and your studies. Like, you have to prioritize the other things that make you feel happy. Like, you just have to, like, you know, whether that's exercise, even if that's a walk, whether it's, you know, just not working, not doing any studying one day. Like, it's so important. You know, medicine is such a long degree, and, you know, it's not even the degree, it's there afterwards. It's a long career, and it's can be a tiring and draining career. So burnout is obviously highly likely for individuals that just work. And I sort of my motto is that I'd much rather get sort of like 20% less in an exam, but actually be happy and enjoy life. So I think it's the way that you start viewing things at medical school. Yeah, I don't know whether I've really answered that question.
No, it's really important, and burnout is an interesting whole other. I myself, for example, it was just last week, so not the week that's just gone, but the week before, I burnt out incredibly badly. Had like hit the end of a very long, stressful period, doing a lot of work, doing a million and one things on the outside, and just had, I think it was 2 days, maybe Thursday and the Saturday of that week, I just physically could not like bring myself to get out of bed in the same manner. And Johnny Guckian, Dr. Johnny Guckian, I was talking to about this recently, and he makes really good points about, and you've just spoken about it there. It's often better to do slightly worse in your exams and still maintain your happiness and your sanity where you can, and remembering that your grades in medical school actually count for like nothing, relatively speaking. They really don't. And I don't think that's something, particularly if you're thinking about applying to medical school, guys, and you're worrying about coming in the top 10% every year or whatever, like, A, it's probably not going to happen statistically, so prepare yourself for that. And B, the SJT, which we'll be sitting, I'm sitting at the end of this year, in fact, this situational judgment test, just like the one you'll take in your UKCAT when you do that, counts for 50% of your entire score when you apply for your first jobs as a junior doctor. And in fact, your 5 or your 6 years of medical school, your performance counts for 9%, something like that. Like it's nothing. So moving very swiftly on, I wonder if it's worth touching very briefly on the incidence of mental health conditions among medical students, because I think the literature suggests that there is not only a spike when people go to medical school, there is a spike in these diagnoses, and there are also spikes at certain times of year as well in the run up to exams. Why is it, do you think, that, if you can offer any insight, why it does seem to be a thing with medical and dental, these types of degrees, why do these people display higher incidence, do you think?
So I get asked this quite a lot, whether I think it's, including doctors, whether it's the profession or the degree, or whether it's the people that medicine attracts.
Yeah.
Oh, so sorry. Oh my God, someone's trying to FaceTime me. Yeah, so I get asked that a lot, and I really think that it's the person and the personality. Like, yes, okay, the degree is stressful, the job is stressful, it might play a part, maybe like 25%, but I think 75% of it is the type of person that medicine attracts. I think most medical students are perfectionists. They're used to scoring A stars, A's in exams. They have to, when you apply to medicine, you have to be like captain of this sports team, this grade on a musical instrument. You have to be like this perfect human. You can't be, grade 1 at the piano, that's not good enough. But actually, anyway. So I think it's massively that kind of person. And I think the nature of medicine, they want you to be like this caring and empathetic person to be a doctor. And I think sometimes that goes too far, and then you actually forget to care about yourself. And I think we're all extremely hard on ourselves. I think, we're never happy with sort of 50% in exam, maybe. Like, we're all striving to be the best, rather than like, I don't know. I think that's my kind of stance on it. Like, personally, I don't find medicine as a degree like that stressful. I don't think for me that's sorry, there's a fly. I don't think that's what triggered my illnesses. I think it's more within myself. Like even when I spoke about anorexia and kind of the stress of getting into medical school, I think that was more pressure that I was putting on myself. Like I kind of thought that getting into medicine was the be all and end all, and if I didn't, I'd be like massively letting down myself. Like no one else was putting that pressure on me really. Like my parents weren't even, they're too chilled.
Yeah.
They were like, you'll be great whatever you do in life. But it's kind of like internal pressure that we will put on ourselves. What
That's
do you
really
think?
well. That's really interesting, because that what you just said there. What I was going to say is that I think if you're interested in particularly psychology, and you read, and I don't know how much you buy into like big five personality traits and things like that, but medical students, when you look at the big five, in terms of things like neuroticism and conscientiousness, there is a particular medical personality profile that is quite it's quite well defined, I think, if you look in the literature, and it tends towards that quite highly agreeable, hardworking, but also quite neurotic, which makes you more sensitive to things like depression and negative emotion. So if people find that kind of thing interesting, but it also, I want to echo what you just said about what you have to remember is that most people who would make good doctors, because of the personality and the skill set that you usually have to have, you'd probably be great at a lot of other things, because as you say, they want you to have straight A's. They want you to, you know, have got this experience and that experience and all your work experience and be able to talk to people. And because of all these things, you'd probably be pretty successful at most things that you applied yourself to. So even if you apply, you know, if you apply in a given year and maybe you go to interview or you sit your UKCAT and you're not successful in that year, even getting your foot even marginally in the door is a huge, you know, well done. It's a really big achievement, because it's a difficult process. Now, towards the latter tail end of this, I was very interested in what you said about GP specifically and being a mental health advocate. You've kind of told us about why you want to do these things, but my reflexive reaction to that was,
They're not psychiatry.
yeah, I was like, they're not. You know, there are lots of specialties. To, you know, GP, arguably emergency medicine. I think when I was doing my ED rotations, I actually saw more psych patients than anything else. So yeah, GP, psych, obviously psychiatry, ED, even neurology. There's a lot of the neuropsychiatry side of things. What is it about GP?
Well, I'm not going to sit here and say that like mental health is like the be all reason why I went into medicine. Like I do find like physical health illnesses interesting as well, but I think it's sort of being at the level of the community like really appeals to me, and I think that's when you can have a big impact. Like myself, I've never seen a doctor in secondary care for any mental health illnesses that I've had, and that's not to say they weren't severe. Like I was diagnosed with severe depression, anxiety, but my GP was able to help me and point me in the right directions. And I think that sort of, although GPs nowadays maybe don't have as long-term a relationship with patients as they did in the past, I think there is still a massive element of that. I know that I spoke to the same GP about 10 times. Yeah, I think that side of it appeals to me. And then sort of moving away from the mental health side, it's kind of the not knowing what's going to come through the door. Like it could literally be mental health or physical health. And some people say, isn't it really boring because you're just going to see like sprained ankles and sore throats? And I'm like, well, even if it is that person thinks they have a broken ankle but it's just sprained, and you're able to offer reassurance and you're able to make them sleep at night kind of thing, like isn't that massively powerful? To be honest, I have considered A&E emergency medicine quite a lot. I think I haven't ruled it out. Like I haven't ruled out like probably like every specialty. Like I've only just finished third year, but I really like how you can have sort of work-life balance with GP. Like you don't have to work evenings, you don't have to work weekends. I must admit that appeals to me massively. Like I really want a career, but I also want to have a life outside of medicine. And I think that sometimes that's a bit looked down on. Like when you say that, I think people kind of expect you to sort of sell your body and soul to medicine. And actually I don't think that's what will make me a good doctor. I think what will make me a good doctor is being able to have a life outside of it and then actually enjoying my job. So that's why GP is like ticking the boxes for me right now.
No, it's really, I'm keen to do this whenever it comes up on the channel. People often look down on GP, I think, as and they're desperate to recruit. Like every year GP is undersubscribed, but actually for the reasons that you've outlined, what actually seems to happen is people, they go down, you know, training to be a surgeon or doing emergency medicine or so on and so forth, and work very, very hard for 5, 6, 7, 8 years. But actually there's a lot of people that end up just getting towards the end of their training pathway and thinking like, actually, I don't want to, like, I do not want to do this anymore. And then there's that stream coming into GP training where they are actually able to apply all their medical knowledge and their expertise, still have that relationship with patients, probably more than other specialties, I would argue, from GP, but actually having some semblance of a real life outside. And
the kind of like looking down on GP definitely frustrates me, and I'm only a medical student, I'm not even a GP yet, so I can't imagine how it must feel for actual GPs. But I think it's not even deemed as a specialty when in fact it is. And like the skill set that GPs have is amazing. Like they could be seeing someone with first signs of a brain tumor, for example, and if they don't pick up on that, if they're just falling asleep with their cup of tea, then that person might die. Like it's kind of, it is life or death. And I think it depends how you look at medicine. Like I think sort of 10 years, 20 years ago, medicine was sort of like fixing things and making people better, whereas now our patient population has like patients with chronic diseases that you're not going to fix, you're not going to treat some of them, like, but it's about that quality of life, and that's what appeals to me about medicine. Like I've never gone into it thinking that, obviously I have so much respect for surgeons and I think it must be incredibly powerful, like cutting out a tumor and having that, like that reward, it must be so rewarding. And but I just, you know, there's people for that, and then there needs to be more people for GP. I actually heard that they're giving GPs an incentive if you train in a rural place of £20,000. I only
like
heard about that
hello.
the other day, and I was like,
delicious, tax-free.
no.
Oh, yeah, it's definitely true. And in fact, what you've just said, almost the opposite of that, is the exact reason why I want to be a surgeon and don't want to be a generalist, is because I think I would find it too stressful. And this is, you know, I want to train in neurosurgery, like all things going to some sort of plan, is that I like the idea of being a specialist because you at least have some semblance of an idea of what's going to come through. You know, if you're a cardiologist, it's probably going to be, if not a heart problem, at least something in the chest, right? That you can kind of deal with. Whereas if you're sat, as you say, in your GP clinic on a 4 o'clock on a Friday afternoon and someone walks in and you think, you know, oh God, they've got the beginnings of cancer, or they've got some weird autoimmune thing that you're going to newly diagnose them with. It must be like how you maintain the brain power to do that over long periods of time is.
Well, I think that's why some GPs are finding it incredibly stressful, especially because of the sort of 10-minute appointments. And it's kind of like, you know, if you have someone coming to you with like they're suicidal and you've got a 10-minute appointment, and then you've got the next person, you know, in 10 minutes time, it's like, when do you actually take a break for yourself? Do you make the patient, like, I think at times you just have to make the next patient late because you need to look after yourself at the end of the day. Like, you know, that's kind of the reason why I don't want to go into psychiatry, is because I think sort of for my well-being it'd be way too much. I wouldn't be able to deal with it. I'd be taking home everyone's problems. So that's why I'm quite looking forward to a sprained ankle. I don't know why I'm saying a sprained ankle. It's very painful. It's
Get
happened to me
over it.
times, but...
Right. Oh dear. Okay. Well, just towards as we aim towards wrapping up on the note of sprained ankles, is there any, you know, there's one piece of golden advice that you can give to people, let's say, just because of the nature of this interview and your platform and so on? We've got hundreds of people a year, if not thousands, thinking about applying to medical school through undergraduate or graduate or access courses or whatever, that have had some sort of mental health upset, or they're concerned. Tash the Medic, you know, what would you say to them if they're thinking about applying or coming to med school?
Well, definitely do it. That's not any reason to ever not do medicine. And a lot of people worry that they wouldn't cope at medical school, they wouldn't cope as a doctor. And I've worried about that sometimes, but that makes me more determined to get better. Like anxiety, like I actively wanted to get better so that I would be a great doctor. So actually, I think it gives you that drive to get better. So it's a good thing. But yeah, it definitely should never stop you. I think sort of more general advice, like even if you haven't suffered from a mental health illness, and you know, it's highly likely that you might do later on in life, whether it's, you know, full on depression and anxiety, like you were just saying, you might have moments of like burnout or moments where you feel particularly anxious. So it's really good to sort of practice things that make you feel good, you know, from day one of medical school. Like don't neglect looking after yourself and then it's too late kind of thing. Yeah, and I think if you ever get any signs of mental health illness, just seek help the same way that you would as a physical health illness, and it's not a big deal, I promise.
Perfect. Well, what a way to wrap up. Tash, we will leave on the video kind of overlay that you guys are seeing when this goes out. We'll have all of Tash's various channels displayed, and we will leave a link to all of those in the description. You just Tash the Medic generally?
Yeah, pretty much. Instagram
Okay.
is like Tash _ the medic, but
Too complicated. We'll leave the link to those in the description, so please go and check out Tash's stuff, particularly if you're interested in this kind of thing. Obviously it's her bread and butter, and I'm sure she won't mind you getting in touch with specific problems or queries. Tash the Medic, thank you so much for coming on.
No, thank you, it's been great. Feels weird being called Tash the Medic.
Take care, Tash. We'll see you soon.